Welcome to Derm Clarity, Poor Decisions and Flake News. I'm Erica Ramos. I've spent over 21 years in healthcare. I'm a dermatology physician associate, doctorate of medical science, the founder of Restore Scalp, and the host of this podcast. I'm here to help you make sense of your skin without the hype. Just a quick note before we dive in. This podcast is for education only. It's not medical advice, and it doesn't replace the care you receive from your own provider. My goal is simple: to help you understand what's happening with your skin, hair, and nails, so you can make informed, confident decisions alongside your care team. Welcome back to Derm Clarity, Poor Decisions and Flake News. Today we're going to talk about a question I get a lot in clinic from parents, which is, my child's dealing with acne. Is there something that I can have them use before I bring them into you? And honestly, that's a fair question. If you walk into any drugstore, there are shelves full of acne products. Every bottle promises clearer skin. Every package looks convincing. Everything says that it's clarifying, purifying, balancing, and maximum strength. And somehow, all of them claim to be dermatologist recommended. Today, we're going to pull back the curtain. This episode is not about telling you exactly what to buy. It's about teaching you how to think about acne products. Because if you understand the ingredients, you'll stop shopping based on marketing and start shopping based on science. This episode is educational, of course, and it does not replace the care from your own dermatologist. Acne can be multifactorial. There can be a bigger medical picture. And so if you aren't controlling it with over-the-counter options, you definitely want to seek out the care of a dermatologist. If you've ever stood in the acne aisle wondering if you're about to make a good decision or a poor decision, this episode is definitely for you. Here's the secret. There are not hundreds of unique acne treatments out there. There are hundreds of products built around a handful of active ingredients. Most over-the-counter products revolve around benzoyl peroxide, salicylic acid, adapalene, sulfur, and sometimes azelaic acid. Think of it like coffee. Their menu may look huge, but most drinks are espresso wearing different outfits. The active ingredient matters far more than the branding. One of the biggest mistakes I see patients memorizing is product names instead of learning ingredients. Product names change, marketing changes, packaging changes. Ingredients are what really tell the story. Let's talk about drugs versus cosmetics. And it all boils down to a drug facts panel. If a product has a drug facts panel and claims to treat acne, prevent acne, clear acne, it's regulated as an over-the-counter drug. Cosmetics are different. Cosmetics can say they improve the appearance of skin, reduce the look of redness, brighten the skin, or help the skin appear clearer. Notice the wording. One is claiming to treat. The other is claiming to improve appearance. Neither category is automatically better, but understanding the difference helps you become a much smarter consumer. The front label is all marketing. The drug facts panel is where the science lives. Now that we have kind of figured out how to tell the difference between an over-the-counter medication and a cosmetic product, let's move on to what acne is. Acne doesn't necessarily mean that you have dirty skin. So let's retire that myth immediately. Acne is influenced by oil production, clogged pores, inflammation, acne-associated bacteria, hormones, stress, skin sensitivity. There's a lot of factors that can go into it. That's why one person's acne responds beautifully to a simple routine, while another person's acne needs prescription treatment from a dermatologist or their primary care provider. Different acne types behave differently. Blackheads, whiteheads, little papules, pustules, so little red bumps, or those white pimples, cysts, nodules, which are those red bigger, more inflamed, don't pop kind of pimples. They're not all the same. Understanding that helps explain why one product doesn't work for everyone. Let's start with one of the workhorses of acne treatment, benzoyl peroxide. Benzoyl peroxide helps reduce acne associated bacteria and inflammation. It's especially helpful for red, angry, inflammatory acne or pustules. One misconception is that the stronger the concentration, it automatically works better. But benzoyl peroxide can be drying and irritating, so higher strengths of it could potentially cause redness, inflammation, irritation of the skin. Research has actually shown that lower concentrations can often perform very similarly while causing less irritation. The downside is the dryness and the irritation that I talked about. The other really big downside to it is that it loves to bleach little spots into fabric. So your towels, your pillowcases, your sheets, maybe even your clothing if you're applying it at the wrong time. So if you've ever ruined your favorite pillowcase, there's a decent chance that there was benzoyl peroxide in your product. A couple things you can do to help avoid that bleaching effect of fabric is to make sure you're doing a thorough rinsing after your benzoyl peroxide wash. If you're applying a topical benzoyl peroxide that is a leave-on, you want to let it fully dry before you touch your fabric. The other trick is just having white pillowcases, white sheets, wearing a white shirt to bed. Those things can help you avoid ruining your most favorite towel or your most favorite sheets or your most favorite t-shirt. For oily skin, benzoyl peroxide can be a fantastic option. For dry, sensitive skin, we want to maybe approach that cautiously because, like I said, it can be drying and irritating. Salicylic acid dives down into pores and follicles and helps clear them out. It's oil soluble, which means it can work inside the oily follicles and can also help to loosen up dead skin cells that help to contribute to the pores and the follicles clogging. Salicylic acid shines when we're dealing with blackheads, whiteheads, congestion, and texture. It's exfoliating and clarifying, and it's getting deep down in there and cleaning those pores out. So it's getting rid of those blackheads and those whiteheads. Where people get into trouble is using it in 5 different products at the same time. You just don't need every product to have an active ingredient in it at the same time. For example, a cleanser, a toner pad, a serum, and a spot treatment all containing salicylic acid, it could be a recipe for irritation. In general, I find that even my relatively dry skin individuals still tolerate salicylic acid. It is relatively gentle. If somebody has extremely sensitive skin, they may find that it's drying and irritating. But for the most part, I feel like people who have a little sensitive skin, little dry skin, then salicylic acid can be tolerated. Adapalene is one of the strongest over-the-counter tools available. It's a retinoid. And so it is the only non-prescription retinoid over the counter. It did back in the day used to be prescription. And so now it's got its friend. Adapalene has a stronger version that's still prescription. The less strong version is an over-the-counter medication. Adapalene is a retinoid. It's one of those 3 things, those top 3 things that we tell people to use on their skin for skin health. So sunscreen, vitamin C, and a retinoid or a retinol. Retinoids are stronger than retinols. And most over-the-counter things that have retinol in them are kind of the watered-down versions of retinoids. But adapalene is available over the counter, and that is pretty exciting because there is an over-the-counter retinoid that's a little bit stronger and a little bit more effective. So retinoids help normalize how your skin shed and turnover happens. So that active turnover of dead skin cells, helping prevent clogged pores from forming. Adapalene is not considered a spot treatment. So it's generally a pea size or a chocolate chip size amount. And we always kind of crisscross our face with this one when we're talking about it in dermatology. But you put that pea size amount on your fingertip, you dot it on your forehead, both cheeks, your chin, and then you spread it in full face. And that gives you an even application of the adapalene, even though we're only using a pea size amount. One thing you want to consider is that more is not better. More is just more drying. So that's why your dermatologist is going to tell you pea size amount for your full face. Adapalene is a long game ingredient. This is where I'll see people who have a little bit of unrealistic expectations. People use adapalene for a week and wonder why their skin isn't perfect already. Or they'll get in that 2 to 4 week period where your body is purging a little bit and they'll give up and they'll say it's actually making their acne worse. Don't think of this as making your acne worse. If you're purging, your body is actually clearing out the pores from the stuff that needs to be cleared out of the way before you can actually be clear. And that's usually going to happen around the 2 to 4 week mark. And once you get through those 2 to 4 weeks, you're going to start to see clearer skin. If you're a purger, you're going to purge with other ingredients too. I don't think that there's in particular one product out there that makes everybody purge, because there's individuals who will not purge and there's individuals who will on the same medication. That's an individual thing. And those people that do purge end up very frustrated with their acne care because they think that everything is actually making it worse because they never actually get over and through the purge. Friends, we are remodeling those pores. We're clearing them out. There's no quick fixes. And I know our social media tends to make it seem like there are quick results with everything. But in dermatology, your dermatologist is going to tell you that most things, skin, hair, and nails, are going to take about 3 months to reap the benefits of. It's a long game. Again, it's not something that's going to happen overnight. It's something that you have to have patience with. These medicines take a little bit of time to work. And the other thing is, if they don't get on your face, meaning you're not consistent with your use, you're not going to get the results that you deserve. So consistency matters more than intensity. Putting less on is better than putting more on, because you're just going to get more irritation from these ingredients if you try to over apply. Okay, let's talk about azelaic acid. Azelaic acid is an underrated ingredient, but it actually brings a lot to the table. It's very gentle. It can help with acne, redness, post-inflammatory pigmentation. It can help even out skin tone. We use it in our most sensitive skin patients as a great treatment for rosacea. Patients with some sensitive skin often appreciate this one because it tends to be gentler than the other options that we just talked about. Okay, sulfur is another ingredient that has been around forever. It can help oily, inflammatory acne, but it also is gentle and can be used in individuals who have rosacea. So our rosacea-prone skin patients tend to have pretty sensitive skin. Sulfa wash is great for rosacea, acne, people who get seborrheic dermatitis on their face, like they get flakies in their eyebrows or around their nose. But sulfur can be pretty stinky. It can definitely have a smell. Sulfur has never been known for its subtlety. Some people love it. Some people open the jar once and decide this relationship is over. If you have a smell sensitivity, your sulfur wash is probably not going to be for you. There are some prescription ones that are brand name that don't have that smell with it, but most of the generic over the counters are going to have that little bit of sulfur smell to them. Great ingredient, just a little bit smelly. Now, let's match ingredients to skin types. For oily skinned individuals, those people that have that shine from the forehead to the chin, at least by the end of the day, everything's oily. You wake up in the morning, everything's shiny. You're feeling like you're always having to get that shine off of your face. You're going to tolerate benzoyl peroxide. You're going to tolerate salicylic acid. You're going to tolerate the adapalene, that retinoid over the counter. You're probably only going to want a really lightweight moisturizer. And what I want to dispel is the myth that oily prone skin people don't need moisturizers. I would still use a moisturizer, just a lightweight one. Combination skin are going to be the individuals that are shiny on their forehead and their nose and a little bit more dry on their cheeks and their chin. And for those individuals, you're going to want to use a gentle foaming cleanser as your wash, maybe not a medicated wash. In general, most of them will still tolerate a benzoyl peroxide or a salicylic acid. And, the adapalene might be tolerated more on the forehead and the nose and might cause a little bit of dryness down on the cheeks and the chin. But for the most part, I feel like combination skin people can still tolerate that over-the-counter adapalene. But you're going to want to use a little bit better moisturizer. So something a little bit creamier, not lightweight like the oily folks. Then we have dry skin. Dry skin definitely needs a little bit more barrier support. So you're going to want to use a gentle cleanser and some good cream-based moisturizers with ceramides. You want to be careful of the active ingredients that you're using. So if you have dry skin, you're probably not going to want to use the benzoyl peroxide treatment. You're going to edge more towards your salicylic acid or azelaic acid with your active ingredients. And some dry-skinned individuals are not going to tolerate adapalene. Some might, but you'd have to balance it with moisturizer to keep your skin from over-drying with that retinoid product. Dry skin doesn't need punishment. It needs a plan. If you are getting dry with your retinoid without adapalene, you can always sandwich it with moisturizer. You can put your moisturizer on first, your adapalene, and then your moisturizer on afterwards. So when I'm talking to a patient in clinic, I'm going to ask them, are they oily skin, combo skin, dry skin? But the final question I'm going to ask them is, do they have sensitive skin? So you can still have sensitive skin even if you're oily. I find it more in dry skin individuals, but you still could have, somebody who has a history of eczema growing up, or maybe still has eczema or atopic dermatitis. And those individuals, I'm going to approach a little bit more cautiously with their acne treatment because I do believe that they're going to have a little bit more sensitivity to the stronger ingredients. For sensitive skin, simplicity wins. You definitely want fragrance-free cleansers, just gentle cleansers or maybe even moisturizing cleansers. Some individuals may even need these cleansing lotions that you don't rinse them off. You literally wipe them on and they're more of a lotion cleanser. Gentle moisturizers. Again, you want something that's going to be a little bit more creamy. You want slow introductions to your actives. So you want to start it maybe 3 nights a week and work your way into using it nightly, making sure that you're moisturizing along with it if there's any dryness. If you're getting really dry with it, again, you can sandwich that moisturizer where you're using moisturizer first, then your adapalene, then moisturizing again. If you're slowly having to get into this, you want to have realistic expectations that it's going to take a while for things to improve because you're using more gentle ingredients and also maybe not using them every night. So it's going to take a while to get there. Let's talk about toners and astringents. They can remove excess oil and leave the skin feeling clean. But for drier, sensitive skin, that tight, squeaky clean feeling can actually be a sign that you have overdone it. You are now too dry. When it comes to cleansers, the right vehicle matters. You need to look at your skin type that we just talked about and decide what can my skin actually tolerate. Foaming cleansers can work really well for oily skin and for combination skin. Creamy or even lotion-based cleansers are better for dry skin or sensitive skin. Sometimes boring skincare is excellent skincare. I'm a very boring skincare girl and I work in dermatology. So let me step back. If we just look at my skin type, I am a dry, sensitive skin girly. I use a salicylic acid wash. I use a topical that has azelaic acid in it. I use a vitamin C and sunscreen. And then at nighttime, I use a gentle cleanser, maybe 3 times a week, and retinol, not a retinoid, because I have dry, sensitive skin. You want to go with what your skin can tolerate. A simple fragrance-free cleanser may not be very exciting, but your skin often appreciates that stability more than the excitement. No matter what kind of skin you are, if you're using something that's highly fragranced, there is a chance that your skin is going to react to it at a certain point. Maybe not right away, but it may eventually get tired of that fragrance. The biggest mistake I see is really stacking too many active ingredients and then wonder why their skin feels tight and irritated and needs so much moisturizer. Just be aware that not everybody's going to tolerate the same product. If you're just starting for the first time with a acne regimen over the counter, pick one active ingredient. Don't throw all the active ingredients in all at once, because if you do have dry, sensitive skin that occurs, you're not going to know which active ingredient caused it. Pick one major active ingredient to get started, use it consistently, and give it time to work. Support your barrier with moisturization and give it time before you add the next active ingredient. Let's talk about when to see a dermatologist. There is a point where it's time to stop guessing. You have painful cysts, you're scarring, there's widespread acne, face, chest, back, butt. And when the acne starts to affect your confidence, your mental health, if your acne isn't improving after a reasonable trial of the over-the-counter treatments, those are all reasons to go in and see a dermatology professional and to consider that you may need prescription treatment. You do not get a bonus point for struggling longer. And parents, please, 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 if you are seeing scarring on your child's face, take them into a dermatologist. There is no need to continue to create more scars. Just get them in and get them taken care of fast, because the faster you get them in and treated, the less scars are going to be on that beautiful child you made's face. Scars are much harder to treat. So let's talk about scars. Once you have an actual scar, and I'm not talking those little pink marks that are kind of what I call dinosaur prints that get left behind from an inflammatory pimple. The pink spots fade, especially with good sunscreen. What I'm talking about is if you're seeing an ice pick mark, like a pinpoint depression in the skin, you're seeing rolling scars, like there's just these rolling depressions in the skin, then those are things that are not going to go away on their own. They're not going to go away with a topical treatment. What we're going to use for those kinds of things are maybe some heavy duty chemical peel on the actual scar itself, microneedling, lasers, radiofrequency ablation, but those things aren't something that your insurance is going to cover. And so, like I said, if you are seeing scarring, I want you to get in and I want you to get treated before more scarring happens. The acne aisle looks very complicated, but once you understand the ingredients, it becomes much simpler. Most products are built around the same handful of ingredients. The goal isn't to find the trendiest product. The goal is to find the right ingredient and the right vehicle for your skin type and to use it consistently. This has been Derm Clarity, Pore Decisions, and Flake News. If you've enjoyed today's episode, don't forget to listen, like, follow, share, and leave a review or your comments. Thanks for listening. Thanks so much for spending time with me today on Derm Clarity, Pore Decisions, and Flake News. My goal is simple: to help you understand your skin so that you can make more confident, informed decisions. Because at the end of the day, better skin starts with better understanding. And here on Derm Clarity, we're all about making better pore decisions without the flake news. When you understand your skin and stop guessing, that's when clarity begins. Because great skin isn't just about what you put on it, it's also about what's happening underneath. Thanks for hanging out with me on Derm Clarity, Poor Decisions, and Flake News. I'll see you next time.